Welcome to another episode of Surviving COVID-19. It's fair to say COVID-19 hasn't done that much damage to Ghana. So right here on this show, we've had the experts discuss why this has been the case, as in COVID-19 not impacting Ghana and the rest of Africa as it has to other countries. This morning, we spent some time getting to understand where Ghana is as far as the country's COVID-19 response is concerned, and but how does the reopening of the airports affect our efforts to contain the spread of the virus, and how effective are the protocols put in place to limit the importation of the virus, especially at a time when most people, or it appears most people, have thrown caution to the wind and are not observing the preventive protocols. We'll have the Director General of the Ghana Health Service, Dr. Patrick Kuma-Aboagye, tell us where we are with our COVID-19 response, the measures put in place at the airport, the tests that are being done and matters arising, so that the experts can analyze and, when necessary, make suggestions as to how or where we can improve. The other panelists for today are Dr. Yaw Bediako, an immunologist with the West Africa Center for Cell Biology of Infectious Pathogens, WACCBIP, University of Ghana. And then Dr. Godfrey Techi is the acting head of the emergency department and lead clinician at the UGMC COVID-19 Treatment Center. And Kwame Sapong-Esiedu, a pharmacist based in the UK and a fellow of the Center for Democratic Development, Ghana. And I also know that Dr. Franklin Esiedu Bekwe, who's the head of disease surveillance at the Ghana Health Service, he's also a part of this conversation. So we'll jump right into it. And if we have I was hoping that we would have Dr. Patrick Aboagye available online, but I don't see him here at the moment. I saw Dr. Franklin Esiedu Bekwe earlier. Doc, if you're available, you could start by telling us what our COVID-19 response is, so where we are so far as a country, as far as the pandemic is concerned. Do we have Dr. Franklin Esiedu Bekwe?
Yes. Hello. Good morning.
Good morning, Doc. All right. Yes, so we have what, 800? The last time I checked, we have 801 active cases, which is impressive. We should be happy that we have been able to control or contain the pandemic as we have it right now. So you tell us, where are we now?
Okay. What I have is the data as at the 3rd of September, and we have an active case of 785, and so cumulatively we have 44,869, and then the recovery is 43,801, and then we have recorded 283 deaths. So if you look at, we decided to look at the positivity by week. You know, if you look at our positivity, what we have is more of the cumulative, which is like 10%, but we decided to look at it by week. And and then for today, we have about 9%. So clearly, if you look at the data over the past, I would say the past 4 weeks, there's been a decline. The maximum figure that we had was around 28th of June, and then it has been declining to now. So now we have even a daily incidence of averagely 50 to 60. So this is very, very much low compared to when we used to have about 800 cases per day. If you look at the regions, there are some regions, about 4 regions, that have 0 active cases, and also Greater Accra, Ashanti are the main regions that have active cases. One thing which is very obvious, I'm sure maybe Dr. Techi would attest to it, is that in trying to talk about the numbers, we also want to see how many of them are severely ill and admitted at the hospitals. And across the country, there's a reduction in the number. There's a reduction in the number of cases on admission. So clearly it tells you that the caseload is low. We also decided to do what we do weekly coverages of use of face mask. What is becoming obvious is that the first week that we did it, we had coverage of about 44% of people who were correctly wearing it. It dropped to 15, then it went to 14.3. The last one we had was 12. It tells you that the average Ghanaian is now, I think, confused in his mind that the disease is no more there. So why are we wearing the face mask? So that's the challenge that we need to address now. We have started implementing the reopening of the airport. We are almost about 5 days now. I'm going to the airport from here. Since we started, we just recorded just a few positives that are being managed. So most of the cases are actually negative. And Ghana is actually implementing a double testing regime. So you come in with a PCR test that must be negative. And then when you get to the airport, we do an antigen test. So if the antigen test is negative, then in that case, you go home. But then if it's positive, they will now take you to the Ga East Treatment Center, where you'll be assessed. And based on the outcomes, you may be asked to do home management, or may be sent to the isolation center, or maybe put in the treatment center. So basically, that's the regimen that we are going. So far, we haven't had any big challenges with respect to implementing the reopening of the airports. And I think we are fine for now. Thank you.
All right, thank you very much. But Dr. Patrick Aboagye is also online. I can see him now. So Dr. Patrick Aboagye, this issue of people not wearing the face mask properly and not wearing it at all, how do we address this challenge?
Well, thank you very much. We are actually looking at the proposal to see how we can get a few champions who constantly remind people about how important it is to wear your mask. Well, there's some complacency stepping in, and we are worried. But we are where we are because of the things we've done. Anyone who move any of the gas off the pedal, we might revert back into where we were before. So there are plans to use risk communication approaches and also some key champions across the country that we will use to encourage people to wear masks, and also particularly the mask. I mean, all the three protocols, but mainly the use of the mask, which we know that has a very high protection for the population. So we are working on something to see how we can quickly ramp up. But we need the media to be honest. I know the media is doing a lot on that, but people feel that it is safe. I think people need constant reminder where we have come from and how we must work hard to stay there. So that's what we are working on. Somewhere next week, you hear something that we're going to do to see how we will ramp it up.
Now, right here on this show, we had a conversation about the involvement of the traditional authorities. And we know that there's some very extremely influential traditional authorities that we can bring on board. How far have we gone with reaching out to them?
Well, with the Minister of Information, we are looking at doing a lot. I think last week we met the Regional House of Chiefs of Volta. Somewhere this week we are meeting the Western Regional House of Chiefs. We have also, from the beginning, encouraged our regions and districts to continuously engage our traditional rulers, not just at the council itself or maybe the regional House of Chiefs, etc., but also the individual chiefs that their districts and their regions interface with. And I quite remember I did that myself at Sefioso when I met on my of Sefioso and on my of around the BN area to see how this can be formed up. And I think they are well sized to do that. And this is something we need to continue to scale up. So when we are talking about champions, we are probably looking at churches, church leaders, chiefs, even students. among others, to be able to ramp up some campaign that allow more people to take care of, to adhere to the protocols, so that we don't go back to where we were before.
All right.
So we are working hard. I mean, there's a whole timetable with information to meet almost all houses of chiefs.
All right. So I want to put the same question to the rest of the panelists, Dr. Yaw Bediako, Kwame Sapon Siedu, and Dr. Godfrey Techi. Do you have any ideas as to how you think we can work and get the people to comply with the protocols? I want to start with you, Kwame.
Well, thank you. I think you are right, Israel, and good morning to everyone on the panel and those listening to us.
Good morning.
We have had this conversation back and forth. I remember having this conversation with Dr. Aboagye and Kofi about 3 weeks ago. And I said,
when you say Kofi, you mean your brother?
Yeah, my brother.
Dr. Frankie. Dr. Frankie.
I struggle to call him Dr. Siedu, same as he does with me. So it's a bit of a challenge. Forgive me, but do that.
You can say Kofi is allowed. You can say Kofi.
Yeah. I mean, I've always called him Kofi. In fact, I call him worse, but I stick to Kofi when I'm on air. So it's not a problem. Yeah, but back to what I was saying, the issue, I'd always had an issue around the communication and the balance between spreading calm and getting people's hormones to react appropriately. And I always had that problem because of the complacency factor. And the complacency factor is not just in Ghana. The complacency factor is becoming global. I mean, if you look in the UK, for example, there was a demonstration in Hyde Park Corner last week where people demonstrated about the mandatory requirement to wear face masks in shops, public places, and on buses. Because even though the mortality rate in the UK has been high and all that, now that it's very low, people do not see the fuss in wearing it. And it's down to human nature. So I think the best place to go is to continually engage the people, continually engage opinion leaders. We cannot get it any other way. I monitor radio and TV in Ghana quite a bit when I have time. And one of the things I've come to realize is that even the publicization on radio and TV has gone down quite a bit, which then means that people think that there are other higher priorities, like the political campaign that is going on currently, than there is COVID. But like I've said, I doubt if Ghana would have a second wave. I think we would have a lower simmering flame, like we're seeing now, where we would have cases going on and on and on and on and on. And what we cannot afford is for that to change into a high prevalence rate because people get negligent.
All right. Dr. Yaw Bediako, what's your take on that?
I mean, I think I agree with Dr. Siedu in that, I guess the challenge has always been you don't want to sow fear, but you also don't want people to become complacent. And that is always a difficult balance to strike, not just in Ghana, but elsewhere. Certainly, it appears as though our mortality rates have been lower than everywhere, than many parts of the world. We still don't fully understand why. But it's also, we also mustn't, fool ourselves into thinking that there isn't COVID circulating. I mean, a paper, we'll probably get into this later, but a paper was released recently from Kenya suggesting that they have as high as 40% prevalence in Nairobi, and are expecting it to peak in other areas in the next 2 to 3 months. Some work we are doing in Ghana with the University of Ghana is also finding that there's actually high seroprevalence. So if you look for antibodies to SARS-CoV-2, you are finding, you can find as high as almost 30% in some parts of Accra. So the virus is circulating. Yes, in some ways, having such high prevalence may explain, at some point, obviously we want to move towards some form of immunity, or at least some shape of herd immunity. So it may not be necessarily the worst thing in the world if we are seeing high seroprevalence rates. At some point, we'll need to see that in order for this pandemic to be brought under control, provided, of course, the antibodies persist for long enough. But I think on the flip side, since we are seeing these pockets of high seroprevalence, it suggests that the virus has been transmitting for quite a while and at a high level within the community. And so people cannot afford to get complacent because there are always people within the community who are at higher risk than others. And as this virus perhaps moves further out of the urban areas, we have the risk of seeing spikes when it moves into rural areas where we have elderly people with potential underlying conditions and less access to the kind of healthcare that people in the urban areas might have. So the risk persists. And I think on your show, the last time we talked about the economic burden of COVID. Now everybody focuses on the borders being closed and lockdowns and what that effect has on the economy. But as the global economy tries to restart and people begin to construct what they call air bridges between places with low prevalence of COVID to allow movement of people, Ghana really needs to have a low enough prevalence that we Ghanaians are allowed to travel freely. Now, if we have a persistent, even if it's not causing a lot of death, if people in Ghana are testing positive for COVID, we will continue to be on the no-fly list, as it were. We will be required to quarantine, and that will severely hamper Ghanaians' ability to move around. So it is to everybody's benefit if we're able to drive this down so that Ghana is on. I was looking, now the airport is open, I need to travel. I was looking to see if I can enter the UK, and I'm going to have to be in self-isolation for 14 days. If I'm going for a 2-day trip, I can't go for 14 days, and just sit in a room, a hotel room, and then go for my meeting. So till Ghana is off that list, some of us cannot travel freely, and that is a problem. So even if it's not killing us, it may hurt us economically because we'll be stuck, not able to travel. So that's another consideration when people, we try to tell people to keep wearing masks. We need to find a way to get this virus under control, not just in terms of disease, but in terms of just being present.
All right. So the conversation really is about the reopening of the airport. And Dr. Patrick Aboagye, I'd want you to walk us through it and explain to us what the measures that have been put in place to ensure that we're not going to have any slippages. We're not going to have people coming in with the virus and not being detected at the airport. Dr. Franklin Sedubeko indicated that we've caught a few negative cases. We sent them to the Ghana East.
Positive.
Yeah, a few positive cases which we sent to Ghana East. So please tell us a bit more about that. How many positive cases have we picked up?
Well, okay, thank you very much. And we've so far picked, my last count, I'm sure we are looking about 5 or so. We don't know how many we picked today. But yesterday we picked some from Turkish Airlines, and we picked some from other airlines, and so, but the number is low. But I want to start with the core objective of why we did put up those measures. First is to reduce any importation of the virus as much as possible. Nobody's talking about risk elimination, but risk reduction. And also make the airport as a safe place to transit or to work in or to travel into, because at our peak, we can do about 7,000 people moving in and out a day. And so apart from just the tests, we have had to raise shields in front of, when you go to check in, it used to be just between you and the attendant. Now there's a glass shield between you and the one checking you in. If you get to immigration, of course, they had a shield already, but they are going to be more protected. We've had on the ground a lot of social distancing steps where each one can stand between, creating the necessary gaps. We have installed a lot more temperature guns out there. If you are not traveling, you cannot get into the terminal. We cannot get into the terminal itself to reduce, and there's only one entrance into the terminal and one exit, so that so a lot has gone on. But finally was the fact that now, before we are able to reduce the risk, we needed to ensure that, number one, anybody who is coming in would have to have a negative PCR test taken not more than 72 hours from the time of the first travel. And let me explain here. That means that if you did a transit in Ethiopia for 2 days, you may get in here when your test may have taken 5 days. But that does not affect you, because the most important is the very first point of travel. If you are left, say, USA, to transit through Addis, you shouldn't have had about 72 hours before the test. The rest of them is no. When you get to the airport, we test you. It's mandatory testing for all. And that test will now identify those who may have turned positive along the way, or who were probably incubating at the time the test was done, so that we can identify those people and refer them for triaging and management based on whatever situation we are in. And so if you come to the airport, we have had to put up a large infrastructure that gives you that flexibility at a very short time, because our main objective is we need a very effective, efficient testing system that says that if you are negative, you are negative. When you are positive, you are positive. So we compare the equipment, which is an immunoassay fluorescence technology. It's not just an ordinary RDT. That machine can do RDTs, can do antibody, that's antigen, and can even do PCR, but we are using the antigen component. Okay, but when you compare, when Noguchi did the testing with the FDA, if the says is negative compared to PCR, it was 100%. If it's for positive cases, we had about 95 to 97% comparability, so which means that it's quite efficient, that the chance that a PCR, somebody who is positive will slip to, is significantly low. But when they say you are negative, you are truly negative. So that's what has been done. And we also want it at the shortest possible time, and that's why this equipment that gives you, one machine can do 6 tests and results in 12 minutes for you to be able to look at that. So that's what we have there. And then when you go there, the port health has been beefed up. We are digitized the whole of the port health. So you fill your declaration form either before your travel, or at the port, it's online. And then your negative, your PCR results is updated. Your now COVID test, your test at the airport is updated, and then port health can take a decision on that. We do that because if you find any positive later, we need to continue doing contact tracing. And secondly, because of the nature of the disease, anybody who has come into the country must know where you live, must know your number. So if there's any way to look for you, need to look at it. You remember during the COVID lockdown period, we had to follow about 35,000 people in this country by calls and follow where they have been. That was the initial phase to ensure that we reduce importation. So broadly, that is what it is there. There's a lot of people are going to have to wear PPEs. When you get in there, until you are declared negative, you are not able to go to pick your bags from the carousel, because that is where it may be difficult to maintain social distancing. So there are a lot of protocols on the ground and indoors things we are talking about. Obviously, children under 5 are also exempted. We also have crew are also exempted from the testing at the airport, but all airlines have their own testing policy to protect them, and that we expect that aviation ensure that those protocols that the airlines have agreed with them are applied for. So if, for example, all air crew must test every 2 weeks, they ensure that is done, and that's what we follow. So broadly, that is what is at the airport. So it's more about risk reductions significantly, and making the airport a safe place to transit business.
Right. You indicated that children children are exempted, but we also know that the children sometimes can transmit, or if the child has it, they can actually pass it on. So they may have been exempted, but if they're positive, they're likely to spread.
Israel, we're talking about risk reduction. Risk reduction, usually children don't travel alone. Okay, so even parents who travel with them may be an indication of a possible chance that a child may have. So we are looking at the inconvenience of having to take the throat or nasal swab of a child at the airport and all those things. We have to look at all that. And like I said, this is all about risk reduction, not total elimination. So certain things have to give. But those who go are followed up. And so that's what we're looking at. And most of these kids are coming with parents who are very close by that. You could also be, for example, if your mother is positive, of course you become a contact, and then you be managed as if you are also positive. And those child, as part of our protocol, will be tested anyway. But it's not going to be routine that all children will be tested.
All right. Now, the other thing that has come up has to do with the cost of the test. And there are people who think that the cost is too much. They compare it with other countries, and they say that we should probably, especially when if we're going for an antigen test, we should be having the cost go down considerably. You have tried to explain, and you've indicated that it's more because of the infrastructure that to be put in place. But there are people who still are not that convinced that because of the infrastructure, we should have the cost being where it is. There's one gentleman, Victor Bampo. I brought him into this conversation because they've put together a petition and they've been collecting signatures to get the president. They want to send it to the president to get the president to relook the fee. Victor Bampo is online now. So Victor, you have the Director General of the Ghana Health Service. You may want to pitch, and let's see if you can get to convince him so that he can pass on your message. Victor.
I say good morning, everyone. Israel, who is the Director General, please?
Dr. Patrick Kuma-Aboagye.
Yes, okay, that was quite some interesting smiling there when you mentioned the cost involved. I say good morning to everyone. Yes, I had a petition going based on 2 factors. Listening to everybody this morning has actually given me an idea. I'm coming purely based on a layman's view. Dr. Patrick, I am coming from 2 points. The first is to do with the rationale for the test itself, that is after one being subjected to having the PCR test 72 hours prior to traveling to Ghana. But I think listening to you, you indicated that there is a likelihood that one could be incubating during the period the test was taken. Assuming the test was taken a day, 2 days prior to, then that still doesn't hold for a test to be done in the next 72 hours when you arrive on the coast of Ghana. Just like I'm saying, I'm coming
Yes, I'm happy you are saying that. Okay, you can go on. Because see, the nature of the virus, I could be positive in the next 2 hours. That's when it depends on how much viral load I get as the virus grows. And so that's why it is. So that's why incubation is probably between from 2 to 14 days. And that change can take place anyhow. Our objective is to ensure that we have reduced that risk to the barest minimum. And that is why we are doing the double testing to ensure that in the first place, we're not deliberately importing a virus for someone who is already negative before you board, which is the risk to the passengers you are coming along with and come into the country. And then also to be assured that people don't sleep in when they have turned. We also do another test to ensure that has happened. And I think a lot of countries are doing that.
Victor.
Yeah, so Victor, yeah.
Mm-hmm. I do appreciate what I've actually heard, and obviously I would want to do due diligence. Just like I've indicated, I'm coming from purely the layman's point of view, and I'm speaking for the masses and quite a lot of us that have to travel from all over to Ghana. I'm taking into consideration where people traveling from neighboring African countries, Togo, Cote d'Ivoire, everywhere you come from, I'm sure that you are going to be subjected to the mandatory test at the airport. The thing is, I have read, and just like I'm saying, I haven't actually done any due diligence to be able to testify. I've seen newspaper reports questioning the accuracy of the test, that is the antigen test, and that is supposed to be coming from in Gucci. Then, if I am allowed to move on to the next stage that has to do with the cost involved. Yes, I heard you mention about our machine being able to produce the results in 12 minutes, and the machine is capable of doing 6 tests at a time. Fair point, but what I have been made to understand is the test that we are having in Ghana is the antigen test. And according to a list that I have here, that is the charges per country for various places. I think on the list, if it remains the same, Liberia is the only country that is currently doing it for free. Most of the countries charging those higher fees, and I think I've seen the UK on top to be charging the equivalent of 200, what do we call it, dollars equivalent. And I emphasize that that's the least it's been stated in dollars. Obviously, it depends where you go to take your test. I know places where you can have the test done for £50, £60, but then that is questionable. I don't know as to the authenticity or which lab actually do this test. But going to the point in regards to the cost involved, which has been my worry, hence the petition, well, most of these countries are doing the PCR test. Ghana is through the antigen, and that is coming at $150 per passenger. Going on there, I've seen that the next closest, the next second on the list that is doing the antigen test is Goa and Malaysia for $28, and India is doing for $7. So there's quite some concern about the amount of money that we or others are required to pay for that antigen test. And I think you should look at it and something should be done about it.
Victor, you see, when we say antigen test, we have the rapid tests, RDTs. That is different from using a highly specific antigen test that has that specificity. Some of the RDTs that we have tested for antigen, we are getting about 40%, 30% sensitivity. Okay, that means that if you take about 10 people, test them, you're going to get about 6 of them wrong. Okay, this is an immunofluorescent assay that looks for the antigen. It's how you look for the antigen, it's the methodology that makes the cost. But you see, we are looking at the value. If you go to China, for example, on the list, you pay, I think, $150. You may have to wait for 6 hours for your results. If you go to Rwanda, it's $75. It's PCR, $75. But you go to the hotel and spend a day or two waiting for your result before you can go back.
Okay, Doc, I'd like to come in. With regards to Rwanda, it's $60. So $50 and a $10 administrative fee. And yes, you have to check into a designated hotel.
A hotel. Okay, so you have to put all that as to the cost to the passenger. We could also have done the same and also ask people to go and look at that. But we also have to look at the fact that in our attempt to also reduce the inconvenience to people, our attempt to also ensure that our industry, as far as the hotels are concerned, are working. You do not want to go and clog the place with people awaiting their results. As far as on the fact that it may also create some safety issues for people along that. So for us, we felt that looking at the cost you incur for all those places that you have to go and wait in the hotel for your results, at the end of the day, we are looking at something that is more convenient for the passengers and at the same cost. So at the end of the day, if we were to have gone to we do PCR tests here. Ghana PCR costs about $60. So if you do $60 PCR, you have to wait for 48 hours. If you go to Yahoo other place, it takes you 48 hours. And you have to put all that within the perspective of the cost and look at that. So we felt that we have a very good method that is even more cost effective. In terms, we've had, let me give you an example. On the very first day, when the KLM had written to me asking for exemption so that they can go to their hotel, they have paid their $1,400 each for the hotel for 2 weeks. When they got to the airport, the airline also demanded that they do a PCR test. So those who are the PCR negative opted that they will stay at the airport and go and have it tested so they can go home. Those who had gone to the hotel who had PCR negative also asked national security if they can assist them come back and have it. So it's about the cost effective, it's about the value of what you want to do. The inconvenience are all part of it. We could have done any machine for at a cheaper cost, that has to be. Now we have about 80 of those machines at the airport, so that like this evening, we are expecting probably about 1,000 passengers arriving within a space of 2 to 3 hours. It has to be done at a very fast pace so that we cannot inconvenience people. We want the airport to remain efficient at this. So I think we must look at it not in terms of the cost of the thing, but also the cost to the traveler eventually, because we are not going to reduce any rates. We are not going to renege on the fact that we need to put measures to ensure that we reduce importation of the virus, and that's why we had a 14-day quarantine. So
Dr.
this
Patrick,
is for us a much reduced effort to look at that.
I have actually heard you, but I think there could be alternatives to what do we call it? The hotel being the only place where people could be quarantined whilst awaiting test results. Here over in the UK, it is not mandatory that you are quarantined at a hotel subject to waiting for your results. And I think self-quarantine has been evolved because taking into consideration, I don't really see any evidence that can conclusive to say that a hotel is a safer place than people being asked to go to their homes, because you've indicated that, well, you do tracing, you have contact lists. So subject to people waiting for their results, being it's 12 hours, 36 hours, or 48 hours, what actually prevents them from actually quarantine, doing a self-quarantine at their homes? I mean,
see, Victor,
yes.
Victor, let me tell you. See, we've had experience of self-quarantine, and there was a lot of indiscipline in Ghana. As a health sector, we have other things we have to do. We cannot deploy all our people just to be following our people in their homes, okay? Because we have malaria, we have other diseases. We are a lower middle income country that has challenges, and so we do not want to also burden the already burdened health sector with this extra work of having to police people. I have friends who were in the UK. He was so self-quarantined. The guy decided to walk out to the beach for about, after 200 meters, he was called that your quarantine is over, go back home. I don't think we have the technology to do those things. And so you need to look at your country's capacity and adopt a policy and a system that you can manage. We've had that, we've been following, tracking them. You know, we have the tracker before. The indiscipline was, so you cannot guarantee that somebody who has given you address, having given you the right address that you can follow. Some of them turn off their phones so you can't even track them. And so that is why we moved away from that self-quarantine. To do a self-quarantine in Ghana, you have to have a national security go to your house to inspect and make sure that there's enough space for you to have self-quarantine. There's the space adequate. You have the capability to self-quarantine, and that's at a huge cost to our human resource. Okay, so we need to come up with a policy, a system that we as a country can manage.
I can understand.
What it is. If you go to Nigeria, you cannot go. They will have to self-quarantine 48 hours in Abuja or Lagos. You can't go outside Lagos until your results are ready before you can leave. These are all measures that, but that also comes as a cost. And so I think, Victor, that's one of the challenges we are having. And that is how we felt that this gives us a very good alternative that creates safety, that protects the people of this country, and also it's more convenient to traveler. I'm sure even if a dollar is costly. I mean, if I can get it for nothing, I will get it for nothing. But someone has to pay for it, either the state or the traveler.
So Victor, your final pitch, and then we can continue the conversation.
Oh, thank you very much, Israel. Well, I've heard Dr. Patrick. I still have my reservation about a few things that is involved in how things are being done. I can appreciate it, and I salute them for the work being done. But I'm still thinking that something has to be done about the cost involved.
All right. Thank you very much, Victor.
Yeah.
And, Dr. Patrick Aboagye, talking about the cost involved, I heard the Deputy Minister of Health, Dr. Okoboy indicates, that a percentage of the money could be going to the allied agencies at the airport, as in the Civil Aviation, Ghana Airport Company, and all of that. Couldn't we have waived that to reduce the cost for the people? Essentially, if we've covered our costs and a percentage of the money is going to go, of the fee is going to go to these agencies, couldn't we have waived that so then we can be more competitive as far as our COVID test fee is concerned?
Well, I mean, that is a policy that can be looked at, but you see, this also creates a huge infrastructure challenge and work for us. We have had to increase our staffing at the portal by 28 people. It's not enough. We're going to move up to about 40 now. They all have to wear PPEs, N95 all the time. You know how much each N95 costs. And this is not just going to be a day's work. Okay, so it has to be something that is, and this is quite a minor, so but it's not even enough. We have digitized the whole place, bought computers, everything to ensure that we have about 8 booths. It's not just, the work is not just at the arrival. We also do the same PPE wearing and all at the departure. And nobody pays anything at the departure. You know, so if you look at the cost that is being incurred by the state and the cost that the state has incurred already, I think that's just a small thing that is just to subsidize the kind of cost that we are incurring. We are going to have to buy a lot of PPEs, and we are giving every client who gets a mask to wear. Every person gets a mask to wear. We have to transport people to the guys who are positive and at no cost. These are all parts of the operational cost that has to be maintained. So,
Dr. Patrick, I just want to get something clear. Are you saying that the people who have to be taken care of or treated, the people who are positive, government is having to bear that cost? Why so?
If you're a Ghanaian, you bear the cost.
Okay.
That policy has not changed. If you're a Ghanaian, you are sick with COVID, we treat you for free. We'll feed you and treat you for free.
How about the people who are not Ghanaians, the foreigners?
I think that one, a lot of them have some form of insurance that will take care of that. And so those who have insurance will take care of that, and we'll see how that one. That they don't get it for free, and they pay for the cost of treatment. And that's why they have options as to where they want to be treated for.
That's good to know. All right, so I want to give the opportunity to the rest of the panelists if you have any ideas as to how we can go about this cost thing, because there are people who are actually Ghanaians who are out there who've been stranded or who've been seeking to come home but have not been able to, and they're looking at this cost being quite prohibitive. In fact, these are Ghanaians who couldn't afford to pay the mandatory quarantine at the hotels, and so they've waited, and now it turns out that there's another stumbling block. So I just want to put it to the rest. Yeah.
Israel, you are moving from $1,400 for quarantine to $150. So it's a huge reduction.
I know Victor is going to disagree with that, but the rest of you,
Israel, I would want to come in here. Yeah. I have listened to them. And the points he makes, a few of them run through with me. I mean, my brother will be the first to say, anytime, I've lived here for over 2 decades, but anytime I'm in Ghana, it's his phone number that I use as my contact. So for example, if I've gone through the net and you're looking for me, you probably are going to get hold of Kofi because I can never remember my phone number in Ghana. So that is granted. And that's an assertion I would make. But I am also looking at it from this point of view that you have put this in the arrivals in the international airport. And like Victor said, people are going to be arriving from the West African sub-region. If you look at the cost of airfares, even from between Ghana and Nigeria, we're probably going to be charging people more for their testing because they've got to test PCR in Nigeria, then do an antigen test in Ghana, then it is going to cost them to actually fly from Abuja, Lagos, Port Harcourt to Accra. The same thing is going to happen in someone flying from Togo, Lomé, or from Abidjan to Accra. Then if you look at people like myself and Victor who live in the UK, and that's one thing I'd want to correct as well. When it comes to the PCR testing in the UK, the price.
All right, is it the case that we've lost Kwame Sapong-Esiedu? All right, Dr. Yaw Bediako, yeah. So the same question, are there alternatives? Could we handle this in another way that we can reduce the cost?
I mean, I think for me, I mean, there are a number of issues that I think stand out to me. I mean, the cost is the last thing I really want to talk about, to be honest, because I think the government has made it clear that there are a number of extra charges that have been added. I mean, Dr. Aboagye has said there's a number of admin costs and so on that are being considered. I do think for an antigen test, I think the cost is a bit high. I think if you look comparatively to what other countries are charging for PCRs, you know, and the idea that we are using a fluorescence immunoassay, I mean, to be perfectly honest, you know, yes, it's a slightly more sophisticated way of doing it than a standard RDT that you look at for a band, but it's relatively equivalent. You know, I mean, it's an automated. To be honest, the fluorescent immunoassay is an automated RDT. If you strip down all the fancy, you know, nanotechnology and other things that have been talked about, at the end of the day, it is a lateral flow device that is measured by this machine. And I believe, having looked up the device, the test kits themselves cost about $20 per person. The cartridges, it appears, are around $20, and then or maybe less, but I think the number I've seen is 20. And I think then you have to buy the device, which may be a few thousand, you know, maybe even up to 10 or 20,000. But that is a one-time charge. Now, if we multiply, I know, yes, we're getting $150. Dr. Aboagye said today there'll be about 1,000 people arriving within the span of 3 hours. That's $150,000 in one day. So if we think about the initial cost to set up the airport, I believe that can probably be recovered within the first 2-3 weeks of running the operation. In terms of the money that was laid out to buy the equipment, to put up the new plexiglass screens, all of that can probably be recovered within a relatively short time. So perhaps what the government could do is to sort of, over time, once the costs are recovered, then they could think about perhaps maybe dropping the price to something that is a bit more manageable, or having different cost structures for those from the West African sub-region, charging them a certain amount. So maybe making it a proportion of your airfare. Now, these are all things that could be explored to try to make it more attractive to people. Like I said, as a scientist, I can only tell you what the test itself will cost. Now, I don't think the test per person is going to run much more than $20 per person each time. Now, that is, of course, not factoring in the cost of the machine that you've bought. But once you've recovered the cost of the machine, the kits themselves, you know, these manufacturers cannot make money if they sell a kit that costs $30, $40, $50 per person. No one will buy those kits. These are meant to be one-time use device, you know, sort of cartridges. I think the cost, I hesitate to argue too much of the cost, because I know that there are certain considerations that I'm not privy to, that Dr. Aboagye and others in the Ghana Civil Aviation and the airport company have factored into the cost. But I do think it might be possible if, you know, they may have to observe if the cost becomes an issue, if it's a barrier to people coming to Ghana, which in itself would hurt us, then perhaps there may be things that could be done after a period. Once initial costs have been recovered, perhaps you could do something to think about staggering the cost. But my issue as a scientist, I really...
Dr. Yaw Bediako, I want you to hold on a bit. I want to put this to get the reaction of Dr. Patrick Aboagye. And Dr. Patrick Aboagye, in addition to what Dr. Yaw Bediako has said, I would also want to find out who is taking up, or who is conducting the test at the airport, or is in charge of the test at the airport. Is it government? Is it Ghana Health Service that's doing that, or there's a private company involved? Hello, Dr. Patrick Aboagye. You'll have to unmute first, please.
Okay, sorry.
Yeah.
I'm saying that it's a private vendor, okay, who is offering the service. Apart from the cost build-up that Dr. Bediako mentions, we also have the human resource. They have to hire people who are taking swabs, I think about 200 of them, including the lab technologists who are in the 2 labs working 24/7 to look at that. So the cost build-up is not just about the machine, but also even the human resource who are being used to look at that. And so it's a vendor, it's not the state that is offering that service.
Now
of course, eventually, like Dr. Bediako said, that means that over time, some negotiation can continue to be done, but it's a private vendor.
All right. Now, this private vendor, I'm thinking, couldn't we have gotten Noguchi, which would already have the equipment and all that, to do the test rather than bringing a private vendor? Because the private vendor clearly is also having the profit motive in mind.
Well, I mean, there are many options, but I'm sure we looked at all that, and the state's aviation health, we looked at all that, and we thought that this was a much quicker way, because Noguchi would have offered a PCR, and that doesn't address our challenge in terms of the delay at the airport.
All right, Dr. Yaw Bediako, you were making your point, and you're saying that yours is not so much about the cost. You have other concerns.
Yes. So, well, yes, my main concern is, I fully understand I understand the need for the double testing strategy. I think it's a good idea, considering that they have identified a number of people who are positive who otherwise have slipped through. I think the idea of saying we don't just depend on a PCR done 72 hours, but we want to do a follow-up test, I think makes a lot of sense. My issue is actually with the decision to choose the antigen over PCR. Now, I fully understand the challenge that PCR presents in that it takes longer. Even in advanced countries, probably the quickest is probably 3 to 6 hours of waiting in the airport, which would be a challenge given that, our terminal is not that big to accommodate all these people just hanging around waiting for 6 hours. So if we were to do PCR, we would have to probably go the Rwanda route of having designated hotels where people will go. The reason I guess I fall more on the side of PCR has to do with the sensitivity of PCR. There's been a lot of debate the last 2 weeks about the sensitivity of the antigen test versus PCR. My opinion is that no matter how good your antigen test is, the fact that it's measuring antigen, the nature of the way antigen tests work is they are never going to be as sensitive as PCR. PCR is the gold standard for a reason. And that is because the nature of a PCR test allows it to have a much lower detection limit than an antigen test. So I concede that this may be a very well-designed antigen test, but it is still an antigen test. And so once it is not a PCR, then PCR is more sensitive. Now, individuals are negative for PCR 72 hours before their flight. Then, as Dr. Aboagye said, you are looking for people who have converted within that window. That would dictate that that would mean that if they have converted, that they probably have quite low viral levels because they'll be very early on in their disease. And so my feeling is you need a solution that is as sensitive as possible. Now there have been some, I know the Deputy Minister of Health and others have declared that this test is as sensitive as PCR. That is not, I don't know how else to put it, but that is not scientifically plausible because it is not a PCR test. And so, in fact, if you look up this device online, the manufacturer themselves declare that the sensitivity of this device is around 87.5, which is not bad and certainly has utility, but it is not comparable to the 95, 96, 97 that you see for a PCR test. And so it means that a few more people potentially could slip through the cracks. And so for me, that is where I would wish that the discussion would revolve. I don't think it is sufficient to just say that based on the validation by the FDA, the device is 99%. because based on what we understand about the technology, PCR is always going to perform better. And I think even Dr. Aboagye said that today, that compared to PCR, it was about, they said 94, 95% of PCR positives. Now, PCR itself is not 100%. So if you are thinking about a sample being positive in general, and PCR gives you between 95 to 97, and then this device gives you 95% of PCR, then obviously we are now, in terms of absolute positivity, we are probably in the 80 percentile, 80 something percent range, which would agree with what the manufacturer has published. So that is really where my concern has been. I fully think that we are right in Ghana to be extra vigilant and have an extra test. It's just that if we are going to go with an antigen test, then I think we have to acknowledge that we've chosen the antigen test because it is quick and because perhaps it is cost effective, although the price we are charging is more than people who are doing PCR. So, that creates a little bit of an inconsistency. But if we are going to go with the antigen, then it's basically that we are satisfied that even if the sensitivity is a little bit less, we are still going to catch the majority of people. So if that sort of stance had been taken, I would not have had any issue. And I think colleagues at Noguchi, like Dr. Kofi Boni, who have been in the media talking about the sensitivity, that is really what they are saying. It's that PCR is very, very sensitive. Antigen is slightly less sensitive. If we are going with antigen, well, let's acknowledge that there's a gap, but we are accepting that gap. Or could we do PCR, put people in a hotel? In Rwanda, it's $60, plus they have negotiated with hotels to give low rates because the hotels are going to get people in them every day. So perhaps the government could, I think maybe this is what Mr. Bampo is talking about. The government could negotiate with Holiday Inn and Ibis, all those hotels near the airport, and say, look, your usual rate is $150 a night. We are guaranteeing you people every day for the next, for the next few months, you're going to be completely full. Why don't you charge $50 a night? That way, $70, $75 test, $50 charge, you're still around the $150, but we know it's a PCR test and it's giving a certain level of sensitivity over the antigen. So that is just one alternative, I think, that might be suggested. However, if we are going to do the antigen, then let's accept that antigen is not quite as good as PCR. A few more people will slip through, but in general, we are comfortable with that. Once that is made, because I'll just say, okay, that is an acceptable limit that the Ghana Health Service has accepted. But to equate the antigen to PCR makes me very uncomfortable as a scientist, because that is not scientifically possible. And I think that it's not a good look for us in the sense of it appears as though we are making, it's a misstatement or it's factually inaccurate. So That is where some of us have come, is that the antigen test is a step below a PCR. If either we accept that, happy with that gap, or is there a way we can give a PCR test and still manage to make it affordable and not overly inconvenient for passengers?
All right, Dr. Patrick Aboagye.
Yeah, Israel, let me thank you very much. Nobody has compared the antigen test to PCR. What we have done is that we actually tested it against PCR results. So where PCR said negative, we did a comparison. Where PCR said positive, we got a comparison. So obviously, it is not. That's why I started that the objective is risk reduction, not elimination. So we appreciate that it will happen. Okay. Now, when you look at some of the cost buildup, let's look at the total cost, not just to the passenger, but to the state. Okay. If you put about 5 or 6 hotels that will go and wait, and that means that will require a huge cost. Maybe some of you don't know how much it costs to mobilize the police and the army to escort them to the hotels and make sure we maintain a quarantine status, national security out there, people in there making sure that people don't slip out or people don't move from one room to another, etc. So these are all costs that one has to put together in coming out with a decision. And so it could go that way, but at the end of the day, what is the overall cost? Not just to the passenger, but also to the state. And so we need to look at it in terms of that cost in that broad sense, so that we have those, and of course, the opportunity cost of all the inconvenience that comes up. And so those are the issues that are there. And we still believe that this is this provides an opportunity to get reduced risk of importation, and secondly, the overall total cost is also so reduced. I mean, paying for these things is not easy. My wife will be coming. If she's coming, I have to pay too. So it's not easy, but what can we do? So that's why it's risk reduction. And so nobody has, actually in our testing with Noguchi and FDA, it was matched against our results from a PCR machine. So obviously, if you get, say, 97% accuracy, that still reduces your elimination, especially when even PCR is not 100%. You know, so those are the things we have looked at. And when you're looking at the initial cost buildup, you have to look at the infrastructure and also the human resource. This is not just one machine, one staff. Because we have about 80 machines and you have about 70 cubicles where samples are being taken, someone to run that. You're employing a large number of people to do the test. And so all those people have to be paid. You know, so I think those are the core costs. And so the effort to reduce delay has its cost implications. And delay and inconvenience to passengers reduces inconvenience. So I know that we are not in normal time. We are not in normal time. And so we must also be ready for some of these challenges. This is not something we would have dreamt of 2 years ago, but it's with us now. And there are countries that are banned people. There are countries where even if you cannot travel to some countries because you are from a country, from Ghana, like Siedu said, these are all important factors we must consider that we reduce our risk as normal so that we can also be free as a people to be part of the global system as to look at. So this has not come at an easy decision, but like I said, the most important thing is cost effectiveness and the speed and ease of convenience to the passenger.
All right. Kwame Sapon,
so we'll look at Dr. Bediako's suggestions and look at and see. But like I said, the hotel is not just moving to a hotel, but we have a lot of large maintenance costs of all that.
All right, Kwame. So you were making a point earlier before we lost you.
Yeah, thanks. Basically, what I was saying is that if I look at the cost, like you're traveling from Abidjan, you're traveling from Lagos, you're traveling from Abuja, it will turn out that you are paying more to be tested than for your air ticket, which then means that the whole concept of the African Free Trade Agreement comes into question. Because one of the things that COVID is teaching us is that we need to learn to trade amongst ourselves more than trading with a global community in goods and services that we can't trade amongst ourselves. And therefore, the barriers to travel and trade in Africa need to be brought down as much as possible. I see a situation whereby this pricing, if we don't look at it properly, would be an affront to this whole concept. And why do I say so? I say so because if the person has to pay this amount of money, then he's going to think, for example, if he's a tourist coming from South Africa to go to Kakuma or to go and see a Fajatu or something, he's going to have to make a cost consideration whether it's worth it. Especially so when our prevalence rate is not that low, which then means that when he gets back to his destination country, be it South Africa or wherever, he probably has to quarantine for another 14 days. So though we have cut off one component of the cost, like Dr. Aboagye is saying, $1,400 for staying in a hotel in Ghana, we have still not changed the cost modeling for that individual. It becomes even more serious when you're looking at corporate bodies, especially the oil and gas sector where they travel in and out of Ghana a lot, and they have to come to the UK and all that, the Tullow Oils of this world. They need to think about their travel arrangements very well, because they are going to pay all this money to go into Ghana. But when they get into the UK, they've got to come and quarantine for 14 days anyway. And so I am thinking that considering COVID is going to be with us for the foreseeable future, this thing is not going to go away in 2 to 5 years. is it possible for us to look at a long-term model based on the equipment and all that we have put in place currently? Because yes, it's come at a cost, and I don't expect the state to be burdened with that cost. But could we increase the projected time of that cost? Because it's become part of our airport architecture. The health service, the people who have been employed have created jobs for the economy because they are going to be paying taxes. So we need to try and look at all these things from a bioeconomic calculation in a longer term, rather than trying to recoup the cost very, very early over a short period of time before we drop the prices. Because eventually, what will happen is our own country's economy might be the one that will tank.
Dr. Patrick Aboagye, I think it's a valid consideration.
Oh, yes, it is a very valid consideration. But you see, remember that number one is the fact that what we knew in March about COVID is not what we know now. I'm sure there might be better technology. There could even be a vaccine, and that would change everything. But I think for us now, the most important thing is to reduce any spikes or any situation that returns to the June, July situation that we had. And yes, I know that even if you look at the African Free Trade, you see, the Africa CDC is in line with that. And they're actually developing systems that are sure that people are able to validate PCR results from countries before they come into your country. So this is something that is not just in isolation in Ghana. Liberia and Sierra Leone started this thing long before even Ghana started. Okay, for those, no African country opened their airport without this type of restrictions, especially those who did it. So it's something that we have to look at. Maybe as more people do it, as more airline demand these tests and the volumes go up, definitely the costs might come down. And as we know, COVID has taught us a lot of things, and we are also learning a lot about the disease over time. And I believe that we might also discover something that will make us spend less. But I think we are currently erring on the side of caution.
All right.
Be sure that we don't import. And you see, you don't even have you don't know, it comes in different strains. So maybe get a different strain that may be more virulent than what we have here. So it's important that we be careful, that we look at that. The West African countries, yes, that becomes a big burden for all of us. But I think it's something that we can look at.
Right.
Dr.
Time, as Dr. Bediako said, I'm sure that's not for me to decide, but that's something for the states and maybe the international body to look at.
Yes,
see whether under one of the ECOWAS protocols, something special can be done for ECOWAS or other African countries.
Yeah, Dr. Wadi, the other thing I wanted to look at, which you've brought in, is even the cost to the state and parastatal organizations of these arrangements. I know you, for example, travel a lot. My brother travels a lot because it's part of your job to do these things. You cannot exist in isolation. Without COVID, a lot of you would have traveled, which then means that there's an additional overlay. Unless the government is prepared to waive these things for state and parastatal workers of cost to government. Because I was listening while I went off, and you're saying that this is being provided by a private vendor. A private vendor is not a charity. And therefore, if the government has to do something, they'll have to have a model in place whereby the person can defray their cost. If they want ministers, MPs, and all that to have these tests for free. So that in itself is also another reason why I think the government should start looking at this cost and saying, for how long are we going to be bearing this for our traveling officials? And how feasible is it to bear it for a long time? And that is one of the things that I've always been trying to do the mathematics in my head and try to find out what's the average number of travel from the universities, from ministries, from within the executive, from the judiciary. How much is it going to cost us as a state? And I look at all these figures, I look at the West Africa one, and forgive me, I'm someone who likes to play with numbers. But the more the numbers jumble in my head, I'm like, no, we probably would be better off if we did something about this cost. I think the vendor, from what Dr. Aboagye said, is playing a very intelligent business case, which Like, if there is a vaccine now, then it means that all their infrastructure, if they have not recouped their cost, then it means it's a loss. So they are playing, and that's why I said I look at numbers. And so they are playing the short ball. But as a country, we need to play the ball into the long grass because it's in our interest.
All right. Dr. Godfrey Techi has had his hand up. He's joined us, but he's had his hand up for a while, so I'd want him to come in. Dr. Techi, you have a point to make. You have some contribution to make.
Thank you. Good afternoon. The main discussion has been about cost, so I understand why I haven't been brought on board to make my comments like from the beginning, and I understand why. But for me as a clinician and also as a scientist, just throwing the line with as Dr. Bediako, I'm not worried too much about the costs because I may not have the details as to what went into the costs. But a test that will make me happy is a test that I know will not have too much people coming into Ghana that slipped or we missed. That would make me happy. Because as Dr. DG said, Dr. Aboagye said, I mean, when there's a lot of cases in the country, the burden, yes, the laboratory scientists and all have their own level of stress, but we also have a lot of stress because we are still seeing or doing our normal work in addition to COVID. So for me, if the test or the measures put in place at the airport is to ensure that we don't have too much importation of cases, no matter what we do, some may slip through. Nothing is absolute in science or in medicine. So I think for me, once what is in place is supported by science and the big guys, the biologists, the immunologists are happy with it, I'm okay. I don't want us to dwell too much on costs because, I mean, off this program, as I told you some time ago, Israel, nobody explains to anybody what goes into costing of testing. If you go to Lancet and you are doing a test and they tell you it's 60 cities, you don't go asking for a breakdown. So I don't want us to dwell too much on the cost. Yeah, there may be other repercussions of here not being tourist friendly because of cost at the airport. But hey, I will err on the side of caution so that we make sure we limit importation of cases into this country. Because Israel is serious. Some of us are, I don't want to say we are tired. Some of us are overburdened. People have recovered from COVID, they come to work. They are not psychologically sound to even continue the same pattern. So for me, let's not dwell too much about the cost. The more we talk about the cost, the more some of us get disappointed because it's not about the cost per se. It's about things that will make sure people don't come into the country to overburden us. So I'm happy about the risk reduction and not elimination because nothing in science is absolute. So on that note, I want to say I side with all the views raised by Dr. Yaw Bediako.
In that case, Dr. Yaw Bediako is, he would rather we had a PCR test. Does it mean that's the option you also want to go?
If that's the way to go, I support that. But that will mean we'll have logistical challenges with national security, police. I've been involved in this before up north. So I share the view of where it's coming from. I've been involved. It's not easy. When you've not been involved before, you think it's easy. Getting police, soldiers, national security, and all that. Israel, let me just remind you or refresh your memory. When we put people at the airport in Accra, they were abusing our security guys. If you remember, there were videos all over. They were abusing the security guys for keeping them in the hotel and all that. So I'm sure they've looked at all that. And I don't doubt the competence of the people who made this decision. As for the costing bits, I won't talk about it.
All right.
Thank you.
Thank you. I have some questions coming through on Facebook. Chrissy in Cancer says, I'm a Ghanaian living in Europe. Assuming I test positive from the new instructions, I shouldn't come back home. Dr. Patrick, this question will be for you. And then Anita Iyasamwa.
That is the whole idea.
Don't come.
So, Chrissy in Cancer. Chrissy in Cancer.
Before you come.
Yeah, Chrissy in Cancer, if you test positive, stay wherever you are. When you've recovered, you can come in. Anita Samuel also asked, how can they detect fake test results? And I think with that, that's why Dr. Aboagye will say that we are conducting another test here. So that's to check those who may come in with fake results. But you may still want to answer the question, how can they detect fake results? And Christine Cancer comes back to us, no special rate for Ghanaians. Well, Dr. Aboagye says they're considering it. But the question is, how can they detect fake results? Dr. Aboagye.
Well, we've, Israel, we've asked the airlines and the Foreign Affairs has asked that we have a list of accredited labs from the countries. And so that's where we have a list of accredited labs. That's what they have supplied, and that's what they are using to validate. And that's what the airlines will do. For the first responsibility of the airline to validate your results before they take you in. If you bring somebody who is positive or who does not have a valid PCR, this in the airline will be fined. And so that is why they will not pick you if they don't have, you cannot validate your results.
All right. Then Bernard Togbo says, I think the testing should be free for Ghanaian residents who got stuck because of the lockdowns. These folks never enjoyed free electricity, free water, or any other interventions other taxpayers enjoyed. And Anita Saman says, these tests should be reduced to help us as a people and Africa as a whole in controlling and managing the pandemic. So the question from Togbo, or the contribution from Togbo, he says he thinks the testing should be free because for the Ghanaians who are stuck outside, because they didn't enjoy free electricity, free water, and all the other interventions. Dr. Aboagye.
Yeah, thank you. I think that's something we can discuss. We can. That's not for me to. I can waive that.
All right.
So we need to bring to the ministers and try to see whether that is something that can be considered. But you see, the overriding this thing is that we are going to reduce importation of the virus. So even if you don't do the test, there are alternative measures that we were applying before, that's the quarantine and following up. And that thing, I don't think we want to move that. Go into that. So I believe that over time we'll learn lessons and see how the policy will be. We will provide advice whether something can be done. This evening I'll be at the airport to see what is going on. And mind you, even the rush for people to come, despite the cost, it's amazing. BA is flying 2 flights this evening.
Oh, really?
We have 2 flights from BA this night alone. I'm telling you. So let's look at this thing very well. And people know, and they are coming, and then they are PCR negative, and they are flying, and they are ready to come and pay their 150 to get home. So we need to look at that because, like I said, we are not in normal times. We wish we didn't have that, but we also don't want to get to a stage where we import more viruses. I tell you, what we had today, the results we have today, the positive we have results, a third of them is coming from areas where we are where we have actually kept people who had come into the country on the quarantine. So we still have a significant proportion of people who came in, but now that we are having the PCR negative, that number is significantly down.
Right. Victor Bampo, you had your hand up for a while, so I'd want you to come in at this point before I go to Dr. Yaw Bediako. You'll have to unmute. Victor. Yeah.
Oh, thank you, Israel. I think, what do we call it? My question has been addressed by the various participants.
Right.
I heard Dr. Techi, and it's interesting. I see clearly where he's coming from, but just like he's very concerned about, the practical aspects of the effects. Money always plays a part, and we are talking about the majority. The 2 flights from coming from London tonight, I'm sure it's not for the faint-hearted. I would have loved to be in Ghana today, but for the cost. I don't know if my participation here will give me a special discount tonight.
Are you sure? You don't look like I can pay $150.
Oh, yeah, looks can be deceptive. Looks can be deceptive.
Dr. Aboagye, a lot of people.
Okay, I agree. Okay.
Yeah, a lot of people want to come to Ghana. I mean, I know quite a few people who want to come. I have a lot of things I have to come and do in Ghana. The only thing that's keeping me back is the fact that when I get back to the UK, I have to quarantine for another 14 days. But
it's still
but
you don't quarantine here when you quarantine.
Yeah, but then I'm saddled with about £250 ahead of my air ticket alone, because I have to do a PCR in the UK and I have to come and do an antigen test in Ghana. So that goes on top of my cost. And British Airways is charging exorbitantly because they think it's a cocoa season for them. So that complicates matters. But to go to
a lot of money in the last few months.
Yes, but to go to Dr. Techi's argument that he's making, that we shouldn't think too much about the cost. I always say, as a biomedical scientist, you can never run away from the word cost effectiveness. And that's why everyone is using risk minimization and not total risk elimination. I was looking at something, and I remember writing back in May that this was going to be the only model until we had a vaccine by which the airports could be opened. But if we are going to minimize the risk, which should be our number one priority, at what opportunity cost? That is the balance that we need to get right. For me, that is the balance I am looking for here. That don't let us allow the risks to go up too much. There should be enough risk mitigation. But we shouldn't also allow the cost of risk mitigation to become a barrier for our economy opening up long term. The fatigue, we're all fatigued. I've been practicing as a pharmacist, frontline, which I've not done for years and years, all through this COVID thing. And yes, I am fatigued. I wish I was doing my day job, but I cannot do it at this point in time. I get to do it through Zoom and other things. So we're all fatigued. No one wants COVID to rear its ugly head again. That, and no health professional will tell you they want to do it. But we cannot also allow our preference as scientists and health professionals to make us oblivious about the cost to the general public. That is where I'm trying to find a balance.
All right, Dr. Yaw Bediako, you also coming, and then Dr. Patrick Aboagye would make his point.
Yeah, no, I mean, I think this discussion, I mean, I think there are a few things I've taken from this discussion in terms of, how, the cost structure. I mean, I agree. We can't move away. We can't ignore the cost. I think the reason I think myself and Dr. Techi say we didn't want to talk about the cost is, when somebody says there's admin costs, well, then, it kind of is like, well, I don't know what the admin costs are. So it's hard for me to argue unless I'm going to ask for an audit of all these things. But I fully agree with Kwame's point that the opportunity cost has to be weighed. And that's why I think as we are using an antigen test, my struggle is we are charging PCR money for antigen tests. And as a scientist, I am most comfortable with the PCR. PCR is the most sensitive. If there was a way to do PCR, that is what would make me happy, because then I think we would catch as many people as we possibly could catch. But if we are going to do an antigen test, then I feel that should be balanced, not just by the convenience, which obviously it is currently more convenient, but also perhaps with the cost. And I think maybe that is what we can begin to look at, is we are offering an antigen test, which should allow us to charge less than perhaps what we are currently charging. But one thing I would suggest maybe to allay the fears of some of us who are concerned about the sensitivity would be perhaps, and maybe this is already being done, that a sampling of the negatives be submitted to one of the labs routinely for PCR. So that if you're getting a bunch of negative tests, then maybe you take 10% or whatever percentage you decide of the negative tests, send them off to one of our, because right now the testing labs are not as busy as they were because there's appear to be fewer symptomatic cases. The labs are so a little bit more idle. Perhaps you could have that system where there is a policy that a certain percentage of the negative samples from the airport are sent to Noguchi or to public health reference lab or the vet services, all these places that are now equipped to do PCR testing for COVID, and just have that as an extra safety net. So this may be something that is already being done, but I think it would help to raise confidence, certainly of those of us who are a little bit worried about the sensitivity of the PCR, so that if you find that a lot of negatives should not be negative, then you can reassess the process. So that's just a suggestion I thought perhaps could be added to the policy, just to provide an extra layer of oversight. But then also, I do think that after this initial flood, the 2 BA flights, there are people who are desperate to get home. I think you can't necessarily use that to assess appetite of people who are coming for tourism or coming just for a visit. I think in the next month or so, if the charges remain the same, then we'll begin to get an idea of, is it hurting the flow of people to Ghana? It may or may not, but I certainly think over time, there should be a way, certainly as this prolongs, to maybe spread the cost over a longer time, like Kwame was saying, so that it's not about cost recovery now, but you've recovered some costs now. 1,000 people coming, you've already got $150,000 in the bank. Every day, 1,000 people in a week, you'll be pushing $1 million. At some point, the company should be pressed. The private company should be pressed by the government to say, hey, you have the best deal in the world right now till COVID goes up, to make it maybe a little bit more palatable for people, especially within the West African sub-region. But certainly, if Dr. Aboagye could take forward the idea of maybe sampling the negatives over time and just getting a sense of how good this antigen test really is. Because as somebody who has validated tests before, validation is only as good as the samples you picked. So if you validate a test on samples that are already very, very high, high viral load, then your test will be automatically very sensitive. Majority of these people all these people are asymptomatic, and some of them are going to have very, very low viral loads. So there is a risk that the test, even though based on the FDA assumption that it's very similar to PCR, if those samples were just really good samples, the test may not work as well. And that is why typically tests are validated over tens of thousands of samples over a period of time. So I think we could continue that validation in a sort of a rolling basis, because as Dr. Techi said, Ghana Health Service has no interest in number of cases rising. The moment number of cases rise, it creates a huge strain. So maybe that could be something that could be done to sort of continually validate this airport testing with PCR, and then to raise the confidence level and also catch any problems that may arise down the line.
Dr. Yaw Bediako, you have spoken like a true scientist. I feel like actually clapping for you right now, but Dr. Patrick Aboagye.
Israel, can I say something before you allow? I want to correct, or should I bring some clarity on something that Pharmacy said? Can I proceed?
Sure, please go ahead.
Yeah, Pharmacy Edu, I'm not saying the cost is not important. There's cost to everything. As I mentioned, the national security, all that has cost. What I'm saying is that in line with what Dr. Yaw Bediako said, as a scientist, as a clinician, okay, I don't have too much, or I don't want to say much about the costing. It doesn't mean it's not important. My priority or my biggest concern is anything that will reduce cases to this country. That's the point I was trying to make. I know cost is very important, but I thought maybe it didn't come out well, or maybe you didn't get me well.
No. I got you correctly. What I was trying to say is that all of us on here have a medical background, and therefore we shouldn't allow
except me.
Yeah. We shouldn't allow our science to let us forget about the people who have an affordability issue. So I was trying to look at it from the point of view of the devil's advocate and saying, let's look at all these numbers. Let's look at it from the states, the cost to them. Let's look at it from the individual. Let's look at it from tourism. Let's look at it from African free trade, and bring it all together. So what I tried to do after you spoke was to devolve myself from being someone with a medical background to someone talking from a street standpoint and say, let's drive the cost down. And that's what I've tried to do.
Dr. Patrick Aboagye, the point Dr. Yaw Bediako is making about, considering, taking some of the negatives, sampling the negatives that you get at the airport and taking them through a PCR test. I think it's a fantastic point.
Well, thank you very much. Just before I answer that question, I think I don't have the option of running away because I'm also a scientist and a policymaker, so I have to look at both costs and the science. but yes, what Dr. Bediako said is right. It's something that we are already doing.
Okay, great.
And we are doing that with Noguchi, and so we periodically be sampling that because we are also not going to take chances of that. So that is already something that's already backed into the quality assurance of the tests we are doing. So all that is already part. And so Dr. Bediako should be rest assured that that is being done to ensure continue to see how safe the current policy is. And because the essence is to reduce to the barest minimum any importation of the virus into the country. So we are doing that.
And what is it telling you? What are you getting?
So far we have nothing to worry about. Not much. And so far we are looking at that. We'll be getting the results from Ampofu periodically as and when those things are done, to be checking Professor Ampofu to be looking at that. And so that's with Moguchi to ensure that we have some validation. All right. You know, FDA always will do what we call the market survey. So even after they have given you your license to grow, they will always come to the market and pick one or few samples to test and see whether I saw what you brought to them. And we are doing that too.
Okay. I just want to bring this idea to that I have. I'm thinking that if we're actually sampling negatives, then we could probably batch or pool them like Noguchi has been doing. So we could pool as many as, in fact, why can't we pool all of them and see if anything pops up so that we can decide that instead of just sampling some of the negatives, we're going to sample all the negatives. Is that, Dr. Yaw Bediako, you've been at Noguchi before, so is that something we could be looking at? Not just sampling some, but everything.
Well, I mean, it could be done. I think that the problem would be the logistics. I mean, if you have 3,000 samples a day, even if you pull batches of 10, that would be 300. Now, 300, I mean, it is doable. It's just, it would create quite a lot of work. You'd need the manpower. The question would have to be, I mean, I guess I would say you certainly, I think the idea of using pooled sampling to increase the number of samples that you are testing. So instead of just picking 1 or 2 a day, you say we're going to do 400, and that would be 40 batches, 40 pools of 10. I think that could be done. Obviously, PCR testing is not free, so you'd have to have some, but maybe the $150 could cover that. I would think it probably can cover that. But I think that is an interesting point. I do think we have to be vigilant because, these tests, let's not forget, these tests are also measuring specific things on the virus. And there has been evidence that tests lose sensitivity over time as the virus mutates. So having that kind of redundancy, since this is really a matter of national security, having that redundancy may not be a bad thing. I don't think right now, if we thought there was a problem, then you could go for a week and just say, we're going to sample everything, just mass, and just convince ourselves that the test is working. That would be something, I guess, Dr. Aboagye would have to decide whether he thinks there's justification for that. But I do like your idea of saying, we're not going to just sample 10 a day, and we're going to have a standard system of sampling 100, 200, whatever it is, and have it done on a daily basis, at least for the first few weeks of testing. And perhaps make that completely transparent to the public. We could have the results the same way Ghana Health Service has published results. Okay. We could have a separate section. Since this has been such a polarizing and it has been contentious for the last 2 weeks, one thing would be to say, hey, we're going to test 200 negatives every day, and we'll publish the results online, and you can see for yourself that we're not finding anything. Or if we find something, we're going to tell you what we're going to do. I don't know. That is not that is for Dr. Aboagye and others to decide. That is just a suggestion. Typically, when you're very open, people accept it. So that is just, the pooling idea would certainly increase the number you could sample. Whether we do all the negatives, that level of mobilization would have to be justified by concern that maybe we were missing people. Right. So maybe you start off with a smaller number. And if you find 2 or 3 positives that have slipped through, then you say, look, we have to test all 1,000 and just see what's going on. So that is, but yeah, I think we should, I would advocate for the transparent publishing of the negatives just for a few weeks, just so that everybody can see there's nothing there or there's something there, whatever the case may be.
All right. Thank you very much. Dr. Yaw Bediako, there's a question, Chris in Cancer is really following this. Chris in Cancer sent in another question. It says, in Finland, the results come as an email encrypted, do I have to print out the paper or email? Dr. Patrick Aboagye.
Well, I think you need to be able to show something to the airline before you board. And so I believe that you may have to print and share. Because when we get here, we also will have to check. So I think it's good to have something to show, whether it's on your phone or whatever. We need to look at it. All right, Doctor. But just going back to the sampling, if I can say something, I think
sure, please.
We're doing random sampling. I mean, to test everything is going to be a logistical nightmare. But don't forget that people are coming in there here with a negative PCR anyway. Okay, so we can do a few random sampling. If it's done systematically, it should give us a good indication when there's a need to increase, as Dr. Bediako said, because we are finding some inconsistencies. Obviously, we can do that.
All right.
I mean, for PCR tests, even how the sample is taken is also part of the problem. Okay, so I mean, for these tests, how the samples are taken is important. So we are building that evaluation mechanism to pick some samples at random and just check and see whether it's still consistent with what we expect with a PCR.
All right, Dr. Franklin Isiedubekwe has been part of this conversation. He started with us. Dr. Franklin Isiedubekwe, I don't know if you can unmute so we can see your video, and I'd want to have your take on all that we've been discussing. But so generally, okay, so we have Dr. Franklin Isiedubekwe. So what's your take on the conversation so far? The main point we're getting in all of that, or what I'm understanding from the people who have spoken so far is, yes, the cost could be looked at, but we shouldn't focus so much on the cost. We should look at how effective the test regime is so that we can keep out people or identify people who are positive.
Thank you very much. Let me say that I think that maybe from 2 months or 3 months from now, the Ghana model maybe will be adopted by a number of countries. Because I think yesterday I was speaking to a classmate of mine in the US, and initially he was complaining about the cost. And I tried to explain to him, comparing the old system that you are supposed to quarantine for 14 days and this new system. And he said, then we need to communicate well, because he really understood that we are now having a very better system for the passenger. Now you just pay $150, and then if you are negative, you are going home. Unlike the other system that you have to be quarantined for 14 days. And I think that DG tried to talk about it. You're going to pay about $1,400. Now you're just paying $150 and you're home. The issue is how accurate is the test. And I think that's how Dr. Bediako was trying to see how best you can be sure that we have the quality assurance. So if the samples are truly negative as negative and positive as positive, then we have a better system which is more convenient for the passenger. And then we as a health system will also be achieving what we want to achieve. Because as has been said by Gigi, it's about minimizing the risk. So if we are able to get all positive that we're supposed to get at this cost, which is convenient for the passenger, then I think that we are on course. So to us, we are in early days of this pandemic. I think that's what we have introduced. To me, it's a noble action that hopefully will be adopted by a number of countries if it goes well. So the issue of cost is maybe the one of 150, but spreading it over 2 weeks, you realize that we are paying very minimal for the passenger. And for us, we have gotten a few positives who are being managed, and there are no complaints from them. So we think that whatever we plan to do as a country to minimize the importation of the viruses is actually on course for us. And there's very little resistance. I just got to the airport, so we're going to see the Emirates flight, how it's going to be controlled. There are a few challenges, but I think that is not so much that cannot be handled. as you said, we now have to get additional staff because the whole process means you need to make sure you are very meticulous. So it's early days yet, but I think that as a service or as a country, we think that this prescription is very good for the person and also for the health system. So thank you very much.
All right. Now, one of the things that has come up, or one of the conversations I've been having with Dr. Yaw Bediako has to do with management of the numbers when the passengers come through. We have told them that they should anticipate a delay of about 30 minutes, or that the test is going to take about 30 minutes. But where we have, for instance, this BA flight coming in, 2 flights coming in, if they're coming back to back, then we're likely to have a lot more people. And so the first batch could go through and have theirs done in 30 minutes, but the rest of them may have to wait a lot longer. So I think it also has to do with management of the information or communication, so that we have to manage the expectations. Dr. Yaw Bediako, you had earlier in our conversations, you made the point and you did some numbers and you were suggesting that we have to manage the people's expectations. If you could just clarify that.
Yes, Israel. I mean, these were just sort of back of the envelope calculations, but I think it's been confirmed that we have 80 machines that can do the testing. And there are 70 booths, I believe, I've heard Dr. Aboagye mention. Now, collecting the sample will probably not be terribly, will not take a long time. So collecting a swab probably takes no more than 30 seconds. So we have 70 booths. So that means in a minute, if each booth does 2, that's 140. You quickly move to the passengers. I believe the challenge is going to come with the sample, the running of the sample. So if it takes, you know, the estimation is between 15 to 30 minutes to run. I believe a positive sample probably comes in within the first 15 minutes. But a negative sample, you have to wait longer for it to confirm that it's truly negative. So if that takes half an hour, if we have 80 machines, each machine can do 6 samples, then that's 480. So the first 480 people in line will go through and their results will be ready within 30 minutes. But the second batch of 480, so if you have 1,000, you have 900 people waiting, for instance. If you have 2 flights land or 3 flights land, that's about 300 people each, that's about 900 people. There will be a backlog because the first 480 will take 30 minutes. The next 480 will have had their swab taken just as quickly, but will have to wait for the first 480 to finish before their sample can now be run. And if you have a third group, then obviously they would wait again. So it's just thinking about logistics, and maybe this is what Dr. Bequin was referring to. It will not, even though we've, 80 machines is a lot, considering the, when our airport is up to full capacity and these flights come in fully packed, you have anywhere from 1,000 to I think 1,200 people at peak hours, at peak time within a span of maybe an hour and a half. And that potentially will create certain logistical challenges. So I think the 30 minutes will be for the first batch, but it is possible that some people will probably have to wait an hour, maybe slightly more. So that was what I was referring to. Now, this is just based on hearing what has been described and just doing the mathematics of the time it will take. I also work in a lab, so I also know that the test might take 15 minutes, but somebody has to load it and somebody has to push it in and then wait for the result and enter the data, and all of that adds a few minutes here and there. And when you do things at scale, 1 or 2 minutes times 100 is already 200 minutes. So I think that is just the issue that I pointed out to you, that potentially some people might have to wait a little bit longer in the airport than the 30 minutes. But I presume that that is within the stand what the team have already anticipated.
Israel, if I can just Israel.
Yes, please go ahead.
Yeah, it's a good description from Dr. Bediako, but it's not in blocks like that, because probably the first 20 machines may be ahead of the last 60 or so, because as people queue in and pay their money and go and take the samples, they start running. And so it's a continuous process. It's a continuous process. As people get samples taken, as results come out, it moves on. So the first block is the first probably 15 to 20 minutes that people will have to wait for the first results to come out. Subsequently, they come all the time, because as people come in, I mean, one machine is loaded with 6, it starts running, it doesn't wait for everybody to be ready before it runs. And so it's a more continuous process that takes place. You go and fill your declaration form, pay, and go to the test, and then by the time you come out. So that's how it's a more continuous process. And so as long as we have all the 80 working, it's a little bit smooth. It's not like a block, and then one batch is finished and the next batch goes in. It just continues. So that's how it's made to run.
All right. I have
once the machine has the 6, it starts running.
All right. I have some questions coming in. Yaw Maupomo Fiano says, please, can the accredited labs be made public? I'm in Gambia and yearning to visit my wife and kids back home. I think that'd be a little difficult. Dr. Patrick Aboagye, how do people get to know that the lab where they're going to take their samples are accredited?
I'm sure the airline that they are buying the tickets will tell them.
So they should approach the airlines?
Yeah.
All right. And then Unia Kufia Samoa Mensa says, what informed the $150 testing fee? Well, we've had that conversation, and you can go back and watch. You can watch from the beginning. But essentially, Dr. Patrick Aboagye is making the point that, well, logistics had to be put in place. It cost to put in the machines and all of that. The people, the personnel who have to be at the airport to take the
and human resource.
Yeah, human resource. So all of that went into the $150 testing fee. Plus, of course, there's a bit of that money that will be going to the airports, the Ghana Airport Company, and
very tiny winning stuff. So please,
very tiny.
Don't
okay.
hammer on that one. They're very tiny.
Okay. And Genesis Sigbe says, one of the doctors mentioned the fact that, I stand to be corrected, the best test is to reduce the number of people coming into the country. Will it not be ideal to consider the contribution of the people coming into the country? Is Ghana self-sufficient enough to take such a stance? I'm not sure that's what we indicated here. Any takers, Dr. Patrick Aboagye or anybody else? I see that we have a lady joining us, Mary. Mary, because you have joined us, the fact that you've joined us means that you have been invited probably by Dr. Patrick Aboagye. But if you could just quickly introduce yourself.
I live in the UK. My name is Mrs. Bampo.
Oh, okay. So Victor Bampo's wife.
That's correct.
All right.
And so I've got a vested interest by virtue of being a Ghanaian citizen.
Okay.
And I wish to be traveling home without any undue and high-costed COVID testing, which is shown to be not 100% reliable.
All right. But, well, we've had the conversations. Your husband has made the point, he's pitched, and other people have also pitched in as well. They're saying that Dr. Patrick Aboagye should go back and have a conversation with the rest of his colleagues to see if they could do something about it. Hopefully, who knows? Some Ghanaians maybe Ghanaians who are living abroad, who having enjoyed free electricity, free water, and all that, may be giving a pass.
Possibly, that's right. Thank you.
All right, Dr. Patrick Aboagye. So the question Janet Asigbe was asking, there's one of the doctors mentioned the fact that I stand to be corrected. The best test is to reduce the number of people coming to. I don't think we're seeking to reduce the number of people coming into the country, actually. But says, will it not be ideal to consider the contribution of the people coming to the country? Is Ghana self-sufficient enough to take such a stance? Dr. Patrick Aboagye.
Well, thank you. I think this is part of our effort to probably create some normality in the country so that things can go normal whilst remaining safe. And so the object is not to prevent anybody from coming, rather to facilitate people to come in at less risk to the population and to themselves. So once you get inside, once you get to the country, if there's a flare-up, you're also part of the risk. And so I think it's something that we're trying to do to ensure that we are able to remain safe and also allow things to go on normally. You know, Kwame can't come to Ghana, not because of the 150, because he's more scared of the the 14-day quarantine that is going to finish when it goes back.
No. Dr. Aboagye, that is correct. That is correct. But I am also concerned about the prevalence rate, which was something that Yaw talked about earlier. Because if the prevalence rate drops and our prevalence rates are equivalent, then I wouldn't worry, because
There'll
then
be no 14-day quarantine.
Yes, that's the point I'm making. So I've always had a vested interest in killing two birds with one stone. People have seen that approach of mine as being very brandish, but that has always ultimately been my position, that I would rather we live with this virus at low cost.
Oh, all right.
Yeah.
I have Lee Ejekum also sending in a question. So is the price at the airport going to be reduced when more commercial flights start coming into Ghana? Also, can the PCR 72 hours be extended to 96 hours due to transit flight? So the second question, now Dr. Patrick Aboagye has already indicated the most important thing is getting onto the flight with a test, a negative test. So just get onto the flight. So long as you're allowed onto the flight, when you get here, there's going to be another test. So you don't have to worry about how long your test was taking. Just get it before you get on. And the question about, so is the price at the airport going to be reduced when more commercial flights start coming into Ghana? Please, let's not actually start having that conversation. Let's just say, for now, Dr. Patrick Aboagye is already considering reducing the cost of the fee at the test fee. So he's going to have a conversation with the rest of his colleagues, and hopefully will be done about it. Right, Dr. Patrick Aboagye?
Israel, I don't think I have that power.
I'm saying you're going to have a conversation.
You can only let people know about people's concerns.
Yeah.
And then see how it goes. But that's not for us to go and reduce it. But I guess there's something important. We've also noticed that we have had a lot of complaints from the UK and the US that it's going to be difficult for them to get a result in 72 hours, which is quite ironic that, that they may not be able to get a result in 72 hours. But we'll see how it goes and see whether we can take a look at that, because we've had serial complaints that, especially from the US, that they are not able to get their result within the 72 hours, even when they take the sample early enough. And so it's something that we'll look at, including that of UK. So we'll see how the week goes and see whether something could be done about that.
All right, we have Onuya Kofi Asamoah Mensah also saying, what are we testing? And he writes some things I don't quite get. Probably the scientists will know. I small g capital G / IgM. What exactly is that?
I think I'll help Yaw there, because that's
it's an antibody test.
Yeah, he's talking about an antibody test. What you're doing is not actually an antibody test. This is an antigen test identifying a specific nucleotide on the surface of the virus. And that's why I was saying that if the virus mutates and the H and N, I don't want to get very technical, shift, the sensitivity might change as well. I've tried in this program not to bring my science in, but this one I have to. So they are not testing IgG and IgM at this rate. But what Dr. Aboagye said is that the equipment has the capability of performing IgG and IgM should an antibody test be found that is, capable of giving them the sensitivity and the specificity that they are looking for.
All right, now I'd want to go to Dr. Godfrey Techi. He is the clinician here, and hopefully we can wrap up with that. Dr. Godfrey Techi, you are the UGMC. I want you to tell us what the situation is like. We know that our active cases have come down, declined significantly, but you're the clinician, and so you can actually confirm that for us. I've had conversations with you where you've indicated that, yes, you have very few cases to deal with.
Okay, thank you, Israel. Yeah, we have very few cases, as you rightly said. For us, we are happy we don't have a lot of very sick Ghanaians that will need our care. So it's a good thing for us. But I just want to say that we shouldn't be complacent. We should continue adhering to the safety and preventive protocols. then we should be okay if we all keep doing that. So it's true, we have very few cases. At the moment, I think in the ICU, we have about 3. In the COVID non-critical area, we have about 3. In the emergency room, we have 2. So in all, we have less than 10. So it's reflective of what I've always said is the picture we get from Ghana Health Service when they publish data. So it's consistent. So
right.
That's what I'll say for now.
All right, thank you. Now, I must also say that we have the Ghana Health Service and all those involved in this COVID-19 response have come under have had to take a lot of flack for some of the things that the decisions they've taken. They come in with an idea and we criticize, and in fairness, we're criticizing to ensure that we're getting it right. But some way, somehow, our caseload, our active cases have declined significantly, which means that they have been doing something right. It's either they have been doing something right or God is smiling on just Ghana and the rest of Africa. I'd want to take your quick thoughts on that. Starting with you, Kwame Sapon-Isiodui, we're about to wrap up the program.
Well, thanks. Yes. I think one thing has been gotten right, and that is the use of the face masks. I remember early in this, one on a radio program with Dr. Aboagye, I've forgotten which one it was. I was at that time saying that we need to start it, whatever the risk. And Dr. Aboagye was of the opinion that since the WHO hadn't come out with the guidelines, which he was correct at the time because globally they were not doing it. But perhaps if we had started with the face masks a lot earlier, during especially the time of the shutdown, the selective shutdown, we wouldn't have had these numbers.
All right.
So that is something they've gotten right, but the citizens could get them to get it wrong if they don't continue to wear it. And I think that has been the game changer.
All right. And indeed, we have also done some other things which we started, pool testing, and a number of them which it turned out that everybody else around the world is taking. We probably were not the first, but we did it. Dr. Godfrey Techi, your wrap-up comments. Otherwise, Dr. Godfrey Techi.
Israel, I want to thank you for the opportunity to be here. Though I was left out for a long while because the discussion didn't really need my expertise. But no worries. My brother, Yaw Bediako, was there, and the rest of the panel, they've done quite well to the issues being discussed. But I want to say that we should continue adhering to the safety protocols. Okay? We should just continue adhering to the safety protocols. And let's support, we may have divergent views, but let's be supportive. And even if we need to criticize Ghana Health Service and Ministry of Health, we should be constructive. And let's leave politics out of this, please. Thank you. All
right. Now, Dr. Franklin Isiodui-Bequin, you guys, we must say, you've done some things right. And in addition to all of that, I think God has
many things.
And God has been smiling on us. But yes, okay, I don't have you. So I'll come to you, Dr. Patrick Aboagye, so that, all right, so I have Dr. Franklin Isiodui-Bequin back on. Dr. Franklin Isiodui-Bequin, your final thoughts before we go. I think it's more about we adhering to the protocols, especially the wearing of the face mask.
Thank you very much. So I think that as a service or as the lead for this response, we have been consistent in our prescriptions. As one has been said by Kwame, we push for the use of the face mask. Though it is going down in terms of coverage, but we are still pushing that people should adhere to wearing the face mask. And also, if you look at our approach, where we're talking about TTT, the testing, the tracking, the treatment, this has not changed. We are still stuck by it. We've also tried to expand our laboratory networks so that we don't have this issue of a backlog, which was present in some time past. I think that if you look at this and other interventions, it has been consistent in our reduction of cases. We still want to be sure that with this new approach, we will tighten our contact tracing, that no matter how small the cases that we will get, we're able to mobilize all the contacts and follow them through so that we don't get unnecessary higher numbers to beef up our country count. So I think that I would like to thank all of you very much. I would still want to assure the Ghanaians that the Ghana Health Service or the health sector is ready to battle the COVID. And please, we want the media to be part of our fight to ensure the Ghanaians actually stick to the use of the face mask. Thank you very much.
Thank you. Dr. Yaw Bediako.
Thank you, Israel. I mean, thanks to the rest of the panel. I think, yes, I think the Ghana Health Service needs to be commended for the work they have done. I mean, I think a number a number of doctors and healthcare workers have been exposed and have actually contracted COVID in the course of duty. And I think that should also be acknowledged.
Some have died as well.
And some have died, yes. So, I mean, I think we cannot underestimate the sacrifice that have been made. I think we are still trying to figure out why COVID appears to have been less severe in Africa compared to the rest of the world. There was a story in the BBC that has talked about it having to do partly with poverty, which, you know, they got criticized quite strongly for it. They caught a bit of flack, but I don't think it's necessarily poverty, but there potentially could be a fact that, you know, either exposure to other infections in the past or the way the virus is able to move maybe within pockets of densely populated areas. I think the research will continue for a long time, but we cannot minimize the efforts that have been made by our own health service in really leading in this. But all I can do is add my voice that it doesn't mean we are out of the woods. There is a potential for an upsurge. There certainly is a potential for an upsurge in the more interior areas of this country that may have not yet seen the full brunt of the virus. Unfortunately, I think those are the areas where people adhere even the least to the protocols. And I think maybe that is where we need to start doubling our efforts. Of course, trying to encourage people in Accra to continue or go back to wearing masks. But in the more rural areas, you know, further out from Accra, further out from Kumasi, my concern would be those areas where if the virus is to emerge in those places, we may see some issues. So I think, yeah, the call has to be that we cannot make the sacrifice that has already been made for nothing. The sacrifice has to be worth it, and that means we have to maintain protocols, maintain vigilance, and hope that in a few months Ghana's cases will be down to zero and we can be recognized as one of the countries that have handled the virus. But the virus is still here, it's still circulating. It may not be causing death yet at the moment, but it is still circulating, and we have to prevent transmission as much as we can.
And indeed, you never know who is not going to be so lucky when they get the virus. And that's why we need to continue with observing the protocols. Dr. Patrick Aboagye.
Well, if I could add one thing, Israel,
Sure.
Can I add one thing? Just
Sure.
So in partnership, so at WACCBIP, at the University of Ghana, and in partnership with Noguchi and indeed actually the Ghana Health Service, we are looking at the virus across the country. So we will hopefully make these things public once we are looking to sequence across the country. And so people can look forward to having that information, hopefully in due course, where we can understand how the virus may be different in different parts of the country. So we've done this in partnership. We have approval from the Ghana Health Service Ethics Review Board. And so this sort of data will add to the national efforts to really comprehensively study COVID across the country. And I think this is another way where Ghana would be unique among African countries for having such a comprehensive approach. So I think, I think this would be another way where we can add, and once another way that, the government of Ghana and the rest are leading in trying to address this issue.
Great. Dr. Patrick Aboagye, your final say, you're going to have the final word.
Yeah, thank you very much, Israel. I think I also want to add my voice to Dr. Bediako that we are not out of the wood yet. And we, Ghana Health Service and their partners, the labs themselves, have been quite consistent, despite a lot of, as you said, any initiative is criticized a lot. But then eventually it turns out to be probably useful. So we are working towards ensuring that based on our decisions, if we are convinced that it's right, we'll keep it up. We opened the schools for final years. We had a lot of batch. It's been successful. Other countries are following. And we believe that even this airport testing protocol is something that after initial stages, we will see some other countries adopt it, especially if you get the result that we anticipate. I want to thank everybody for the support. Dr. Esiedu for a lot of the critique that has kept us on our toes, and everybody else. Today, as of yesterday, our active cases are about 785. We expect that when today's results come out to be lower, we pray that we continue in that trajectory until we can actually defeat. But we need everybody to help all of us go back to the protocols and adhering to the protocols strictly. Even then, we are also concerned about the areas where the virus has not been. We will be doing with the labs and with the scientists to look at some exposure level to see whether there's some protection for them, so that we'll see how we can also protect them. And so far, we hope that the virus will continue to disappear as we work towards. And then we need the media and people like Israel to continue providing this kind of platform that allows us to apolitically discuss the issues in a way that will help us not only educate people, but also help us as a service in improving our policies and our structures to improve our fight against the COVID. Yeah. So thank you very much.
Israel, could I say something in response to what?
Sure.
Yeah, I found, thanks Dr. Aboagye for saying the critique. The critique had to happen. I had said to people, and that was why I wanted to keep my brother out, because I had said that it was in my interest not for my elder brother to fail. And I didn't care what price I had to pay for it. And he's known me from infancy that is something I'll do. I'll give him as much as he can take. If I've said same cold blood, we feel like that from infancy. So if the critique was going to come, and if things change, the critique will still come. That's just me. I want the best for everybody. And I think it's helped us all. And it's good that we have these discussions apolitically. And that was one thing I wanted to maintain.
All right. Thank you all for being part of this conversation. I always say that I appreciate your contributions and the fact that you make time to join us for these conversations. And to Victor and Mary, who joined us from the UK, your petition has been heard by the Director General of the Ghana Health Service. We hope something great comes out of it. Dr. Godfrey Techi, yeah.
Yeah, Israel, I want to say that at times we don't honor people. We wait for people to be dead before we honor them. The DJ, I mean, this is one of the most difficult times to be Director General of Ghana Health Service. And I want to say that let's honor him. He's done very well. So DJ, thank you. Okay, so do you want us to give him a UN award? No, not that one. We can all collectively acknowledge him. He's done very well. I'm impressed. Certainly. It's not easy leading at this time. It's not
Certainly. Easy. All right. Thank you all, and you have a wonderful Sunday.
Thank you as well.